College students in Keene, New Hampshire are cleaning up the mess at Keene College, blaming out-of-towners for all the troubles. Crowds set fires, threw bottles at the police, overturned cars, and went to jail. Police made dozens of arrests there at Keene College and responded to more than 200 calls in a 24-hour period. Harley Carnes, CBS News.
The flu, pneumonia, whooping cough, hepatitis A, shingles, meningitis, tetanus. That's a scary list. But did you know immunizations can protect you from every one? You didn't? Well, we do. Rite Aid pharmacists are certified to immunize against the most common preventable diseases. Find out what immunizations you need with the free immunization evaluation at Rite Aid today. With us, it's personal. Availability and age restrictions apply in some states. See pharmacist for details.
I just can't handle the scene anymore. I wish I could find someone who's compatible with me and my values.
Come now. Keep the flame of hope burning. All you need is a visit to Geico.com, the one website devoted to ease, savings, and the long-lost art of chivalry. We'll take you by the hand and escort you through a free rate quote, shower you with policy managing and bill paying tools, throw our coats down in mud puddles to protect your shoes, unless you think that'd be weird. Is that weird? For a free rate quote, visit Geico.com.
KGUM-AM. Gutnia, Guam. News Talk
Comedy
K57.
episode. The 2014 Island Music Awards, presented by The Dress Boutique, setting the standard. Triple J Auto Group, celebrating 30 years of putting customers first, and the Sorensen Media Group.
The nominees for Best Male Performer: Matt Sablan, Raul Garrido, Austin Saralou, Peter Santos, John L.G.
Log on to GuamIMA.com to vote now. Special thanks to Procreate Baby Boutique, The Garage, Joe and Frank's Auto Shop, Mirage Furniture, Diamond Auto Parts, Budweiser, Expression Studio, Black Tie, and the Pacific Star Resort.
The opinions expressed in the following News Talk K57 talk show are those of the show's host, guest, and callers. These opinions do not necessarily express the views of Sorensen Pacific Broadcasting, News Talk K57, its management, staff, or sponsors. Now, let the talk begin.
Witness and half a day. Welcome to Mondays with Monty for this Monday, October 20th, and I have the pleasure of being your host, and my name is Monty McDowell. And during the course of this noon radio show, I ask that you call in, take the show in any direction you so desire by calling 477-5757 or star 57 send on your cell phone. And I've got to segue over to my producer and see how Cookie's doing. How you doing, Cookie?
I'm doing good. How are you doing, Monty?
Very, very good. Now, I thought I heard you on with Patty.
Yes, I was.
So where was her producer? On leave?
Paul, yeah, he has a little family emergency thing going on. Yeah.
You guys just slide in for each other, right? It's all one big family around here.
Yeah.
As long as you get the job done.
Yes.
So I was really interested in Patty's show because I guess Tim Rohrer called up or something, and they were just...
Tim Rohrer, right.
Boy, is he knowledgeable in all aspects of religion. My goodness, he knows all about the seminary and all this. I was driving down here. I said, man, I wish I would have listened from 11 o'clock till 12. But anyway, hey, look at this handsome guy we got in studio here. He's a doctor at the Guam Regional Medical Center,
Half a day.
And so I want to welcome him to the show. We're going to talk about the GRMC, which is the acronym for Guam Regional Medical City, and we're going to talk about all aspects of Dr. Justin Hale's life and times and coming to Guam and where he's been and what he's done and what his specialties are. So, buenos and half a day, Doc, and thanks for being here.
Buenos.
You see, you got the gallery is plotting you already. Wow, this is great. So, how long have you been here now?
Let's see, probably, I guess, 3 months. 3 months.
Yeah. Well, I got here 10 minutes ago. 3 months, so... Are you doing any doctoring, or are you just waiting for the hospital to open up?
A little bit. We've got a specialty clinic open on Harmon Loop, and,
right next to IHP, almost, huh?
Yes, exactly the same complex there.
Yeah, so that's right. My doc's in the IHP.
Okay. Well, yeah, we've been seeing some patients there, and then gearing up for the hospital.
So you're actually actively seeing patients.
We are, yes.
No kidding. Yes. The hospital's not open. You're seeing patients. That's fabulous. I've got a real soft spot in my heart for this new hospital coming up for a lot of reasons. One is I inked a contract to do the housekeeping. My company, so we've been maintaining Naval Hospital for 12 years now. We do all the electrical, mechanical, and housekeeping, and so out of all those credentials that my company has, we were able to carve out housekeeping, and it's pretty important part. I imagine you would say in your profession. You like to work in kind of a sanitary, sterile environment, I assume.
Absolutely, yeah. They have some neat gadgets. At the hospital I was at before, they had these UV lights that would kind of radiate the room and sterilize the room.
Really?
Yeah.
We may have to pick your brain. Maybe we could come over and see it with some.
Yeah, it looked like
come over.
Looked like a little robot that would go into the room and just zap everything.
No kidding.
Yeah.
How long did it take to zap it?
I never saw it in action. So,
no.
Yeah.
I wonder if it's a 1 minute or a 1 hour episode or what.
Sure.
Just go in and zap the room, huh?
Yeah, it's pretty high tech.
Wow. Now I got dollar signs on my brain. What's a contraption like that cost?
Yeah.
That's pretty slick. Maybe you can put me in contact with somebody back there, and I can find out more, because we're always trying to be on cutting edge technology and just get the best we can for the people of Guam and our customers, and that's exactly the way I see GRMC. They're trying to fill, I remember Peter Scrow when he had the committee, and they were bringing people over here and tried to entice them to do exactly what GRMC, and I said, want not to work against Guam Memorial Hospital. We want to work collaboratively with them and to enhance the health care of the island.
Right.
And I like the way they expressed it. I said, wow, that's interesting. Then I see, I think it was Gloria Long was mentioning something about sharing doctors over there now, or putting a doctor or two over that they had a hole in their inventory, so to speak, of the professional going over. And I said, well, that's good stuff.
Yeah.
I mean, the winners in this is not Guam Memorial Hospital. It's people of Guam.
Sure. And certainly on, in the neurology corner, I mean, Ramel Carlos and I have spoken several times. We've had dinner twice, and
who is that individual?
He's the other neurologist on the island.
Okay,
so
and you're a neurologist.
That is correct. Yes.
And what is a neurologist?
So a neurologist, we diagnose and treat.
You did go to school. You do know what it is, right?
I would hope so. Yeah. So we kind of cover the brain, the spinal cord, peripheral nerves, and muscles.
Really?
Right.
That's a lot of stuff.
Yeah, and there's certainly a lot of conditions, a lot of disorders that fall under the neurology
What's
umbrella.
The difference when they say somebody's a neurosurgeon?
Right. So the neurosurgeon, is performing surgery on the brain, spinal cord, nerves.
So you would diagnose and treat, and you say this guy needs surgery.
You don't want me cutting on your brain.
No, you're not a brain cutting kind of guy, are you?
Not that kind of guy. No.
I thought you were cutting edge.
So yeah, and plus it's probably another 2 to 3 years of education that the neurosurgeon has to go through to learn how to wield a knife. So
wow. So you go through school, and you go to medical school, and you go to more school for the specialty, or how's that work?
Right. So 13 years after, it took me 13 years to get through all that after high school. So 4 years of college.
You don't even look like you're 30 yet. And you did what, 8 years of mission work?
Well, that was during all of my medical education, but 4 years of medical school, 4 years of residency, and then I tacked on another 1 year of fellowship in sleep medicine.
Oh, okay, okay. It's interesting. I want to talk about sleep medicine. I want to talk about everything. we got till 12 or 1 o'clock, so we got all kinds of time to talk about this stuff. But your boards, are you really a in psychiatry too?
So the board is a combined board. It's psychiatry and neurology used to be one thing, and so the board, the governing body that actually gives the exam is psychiatry and neurology, ABPN, but there's only a small portion, maybe 20% of my board was psychiatry.
Okay.
But I'm by no means.
So you're not a psychiatrist.
An expert in psychiatry, no.
See, you're not checking me out, telling me I'm left brain, right brain, or
no. They deal with more kind of the limbic structures of the brain, whereas I deal with more of the brain as a whole and
the spinal and the muscular.
Exactly.
Is it most of the patients you see, would they have had accidents? Like a vehicle accident or football injury or something?
Sure.
Or do some people just go through life and they end up with brain disorders and spinal disorders?
Sure. I mean, there are hundreds of disorders that can occur in those structures that I mentioned, and I see a fair amount of concussion and traumatic spinal injuries. But a lot of what I do is kind of the big ones. Stroke. Multiple sclerosis, Parkinson's, and
so stroke is not just the heart; it's that clot that goes to the brain. Is that what it is?
Right. So if a clot goes to a vessel that's in the brain, it's called a stroke. If the clot goes to a vessel in the heart, then it's a heart attack. So it's both have the same underlying kind of cause, which is plaque in the arteries.
Really? So wow. I got stopped the other day in a store, and a person I knew said, "Yeah, I was really debilitated because I had a stroke. I couldn't move half my body or whatever."
Right.
I ended up in Canada, and they went up to my brain and removed the clot.
Right.
Was he telling me a story? Is that possibly a real tale?
Absolutely, yeah. So if
I mean, it was moving, everything was moving.
Right, and I think this is a good education point here for the people of Guam, is that if you have stroke symptoms, and those symptoms have come on within
what is a stroke symptom?
So stroke symptom could include kind of head to toe. It could be half of the vision going out. So if you can't see to one side or the other, could include drooping of the face. This is a common one.
Yeah.
One side of the face.
You see people's lips kind of drooping down, and
some asymmetry to the face.
And that one arm not going too well, that one leg not operating too swiftly.
Slurred speech, weakness, could also be numbness on one side of the body. Those are the common stroke symptoms, and also I would mention difficulty getting the words out. So maybe words are coming out in a real jumbled fashion.
Okay.
So if this comes on suddenly and it's been within 4.5 hours, then you need to get yourself to the emergency department as soon as possible. So call EMS basically.
Yeah.
Call 911.
And what will they do?
So there are several options.
First, they'll call you.
Well, actually,
they want to figure out what he's got first.
I may or may not be involved in the process, and this is where healthcare systems need to be in place. It's not always just on the neurologist, not on the individual, but at GRMC and then also GMH has the clot busting medication. It's called TPA.
Okay.
And
clot busting medication.
Right. So it's a medication that's given IV and within 4.5 hours of a stroke. Now certain conditions have to apply. If there's a bleeding type stroke, it doesn't qualify for TPA. But
it'd probably kill somebody doing that. Huh?
Exactly. So it has to be done very carefully, and not everybody's a candidate, unfortunately. But for those who are good candidates for it, it can be given relatively safely, and it actually increases the chances of a good functional recovery from your stroke.
Wow.
So now the other thing that this acquaintance of yours was telling you about is actually a mechanical retrieval. So they actually snake a catheter up into the.
It's like doing a cardiac cath kind of.
Exactly the same. They go straight past the heart and right up into the vessels in the brain, and those procedures are done by either most typically a neurosurgeon, but sometimes by an interventional radiologist. That can be done in the same time
an
frame.
interventional radiologist.
Right, so a radiologist who's kind of done some extra training and learning how to do these catheters. And
we're going to get well educated in this hour. This is great. This is good stuff.
So, I'm not sure what the what the neurosurgeons are doing on the island so far as clot retrieval goes.
Do we have neurosurgeons?
There are. I think there are 3 neurosurgeons that are kind of come over. They rotate here.
Oh, okay.
Come over from Hawaii or other places.
Alrighty, because I didn't think we had anybody here on a permanent basis, but
right. So,
but we're covered, I guess.
Yeah, exactly. Yeah, I think they are covered for some emergencies, and I'm not sure. I don't. Yeah, I'm not going to speak for what interventions they do or don't.
You're still getting your feet wet.
Exactly. Yeah, but I know that at GRMC we will be giving the clot busting medication for strokes, and I'll be overseeing that program. Could be given in the emergency department if needed.
Will you have a neurosurgeon at GRMC, or will that be a visiting?
So, as far as I'm aware, we're still looking for a neurosurgeon.
Okay, so there's one on the staffing pattern.
Right, exactly.
Yeah, I really appreciate their efforts of recruiting doctors on island and off island. And people like yourself. What did they do to entice you to come to Guam?
Well, you don't
look too well, but
it wasn't a hard sell.
Do you want to go to Paradise and practice medicine?
It wasn't a hard sell. I mean, just pull up some Google images of Tumon Bay, and I think
we don't put in those rain ones like you had the past few weeks. We put like.
Well, I came from Portland, so Portland, Oregon.
Okay,
right.
okay. I'm a UW guy.
Okay,
yeah.
So you know about rain and fog and
yeah, but it doesn't really rain. There's drizzles all the time.
Exactly. Yeah.
But here it rains.
But then the sun comes out, and so you get some sun every day. So it's nice here.
It's a pretty area, Pacific Northwest. Yeah. So you go from a nice area like that to an even better area here.
Yeah.
And it's my story.
I've been lucky to live in some great places. So.
Now I met your lovely wife. She's right outside the studio, and that's one child is it for you right now.
That's it for
before
right
you
now.
get the dozen, cheaper by the dozen. So start with one there, and then get a few more while you're in Guam.
Yeah.
Grow up in the tropics. No better place to grow up.
Yeah, he's really turned into a Chamorro.
I just tell him, why don't you come sit in the studio? Oh, the baby can get a little feisty sometimes. Let's walk back out, no problem. We all get a little feisty now and then.
Sure.
So you were in Portland, Oregon,
right?
Practice of medicine,
right?
And they were recruiting, and it was a match.
Right.
After a whole bunch of negotiation, probably.
Oh, sure. But it was it just seemed like the right thing to do. I mean, my son is young, so he didn't. We weren't gonna. He didn't have a whole lot of attachments. He wasn't in school, and so it just seemed like the right time in our lives to come out, and it seemed like a great opportunity. I mean,
Well, hopefully you stay long enough that he graduates from high school here.
Sure.
I'm already putting the plug in for you to stay.
Yeah, and as long as things are working out, we'd be happy to stay here. So it's we're very happy with our lives here on the island so far.
Yeah, the people that they've recruited to manage the hospital are just phenomenal group of people. So and they even got our own Kevin Kerrigan from over there doing PR stuff. He's the one that contacted me and said, could you be on the show? And I said, not till my next show. Gotta wait till then, So no problem. Then he sends over this thing, and I said, well, that's pretty nice. I said, is that guy old enough to be a doctor? You've done a lot. You went to Loma Linda University School of Medicine, Loma Linda, California. Where's Loma Linda?
Loma Linda's out east of LA, so it's kind of what they call the Inland Empire, kind of on the edge of the desert. And
where'd you do your undergrad?
Undergrad was in Tennessee. That's where I'm from originally, and
Tennessee, Loma Linda. Okay, we got it. Now then living in Portland. You go around.
So, I think my life has always been kind of a progression westward. So
somebody could mistake you for being in the military, moving all around.
Well, I like to travel, like to see new places. So.
And then Wake Forest University Baptist Medical Center. Did you go to school there, or did you do you did your internship?
So yeah, internship being the first year of residency, and then so that was kind of a general medicine year, and then 3 years of neurology after the internship. All that was done at Wake Forest University.
So 3 years of neurology for your specialty.
Right.
So
right.
okay, and
then
I'm always curious, and I hope you don't mind me asking, but
Sure.
I just Joe Citizen.
Uh-huh.
My degree's in engineering, not medicine, and but do you have to do residency? I mean, can you just graduate from medical school and go to Podunk, Idaho, and be the town doctor?
Well, so as soon as you come out of that 4 years of medical school, you're a doctor. You're an MD or a DO, but it takes that, at least that's in the American medical system.
Yes.
But then, in order to be certified by a board, so that in order to have a specialty,
Okay.
and that would include family medicine or internal
So
medicine.
you got to punch some things.
You
got
have
to
to
get
have
your
the-
tickets punched.
Exactly. You have to have the experience seeing patients and treating people. So, back in the old days, they used to just do an internship, a 1 year. You're ready to go see patients. Now the shortest residency is 3 years.
Wow.
For certain specialties. The longest would be probably about 7. And then of course you could do extra years of fellowship on top of that.
Those TV programs where they show people are in the internship and they're like sleeping at the hospital and they're working 24 hours a day. It seems like 7 days a week. And the real doctors are going home, raising their kids, and coming back to work the next day and working 8 hours. Is there any truth to some of that?
Well, you know why they call it residency, right?
Because that is your residence.
It's your residence, yeah.
Really?
And
So there is a lot of
true
truth to
story.
it.
That's a true story. That's people. The doctors used to actually live in the hospital. It was kind of an intensive training where you're basically living at the hospital.
Yeah, and you've got mentors all over that are taking you around and said, "Tell me what you think with these symptoms."
Right,
Dr.
right.
Hale?
Yes, getting pimped is the term that they use.
And then they slap you upside the head if you're absolutely wrong. You're not thinking correctly. You get in here and get there. But after 3 years, I mean,
Sure,
it's like nothing you haven't seen, huh?
Yeah, at least I was never physically abused in medical school, but or in residency. But yeah, there's some pressure.
I imagine. And in any given time, so you were at the Wake Forest University Baptist Medical Center, and you were interning with a couple hundred other doctors, a dozen other doctors.
Yeah, there's at least 100 residents. I'm not sure the number exactly, but there quite a few, all in different specialties. We're training in different kind of different groups in different areas of the hospital, and so we kind of travel around, and there's a bit of these hierarchies, in medical school and residency, where you have the medical students, and they're usually wearing the short white coats, the ones that end at the waist, and then and then you've got the residents who wear the long white coats.
Oh, that's how you tell them apart, huh?
Exactly.
I want the guy with the long coat.
So, if you
send the kids home.
It can be tricky. Apparently, in the out east, some of the residents actually also wear the white coats, but where I trained, that we got to wear the longer ones. And then you have the attendings, who are the teachers and the professors, and they kind of swing in and give their blessing on whatever we're doing.
So I would say, profess that a doctor is always a teacher.
Yes, yes.
Every time you see a patient, you're teaching them something.
That's why I like to have a whiteboard in my office, and
Smart move,
and try to draw things out for people. So,
are you surprised at some of the medical conditions that are prevalent here, like diabetes, that is so high on this island?
Yeah, I think the rates here on Guam are higher than average.
I think they're ringing the bell.
Yeah, it's I always hesitate to say that these conditions are somehow peculiar to Guam, though. These are really American conditions, or not even American, Western, or
oh sure, we're very westernized. You see all our fast food joints. You see them in Portland. You see them
absolutely
in Guam.
So it's a really kind of a universal problem that we all face. We're all in it together. So
you won't be doing anything with diabetes per se, not in your specialty.
Indirectly. I mean, that's one of the first things we look for when patients come in with strokes. So we have a whole stroke workup that we're planning on doing for patients who have had stroke. So we hope that you don't just, stay at home and nurse your stroke. We want you to come in and we'll find, okay, what was it actually that caused that stroke? Was it diabetes? Was it blood pressure being out of control?
Okay.
Was it a clot from the heart?
So instead of just treating the end result.
Exactly.
Treat what caused it so it doesn't happen again.
Keep it from happening again, yeah.
We're going to talk a little bit more about strokes, but it's the bottom of the hour, and we're going to take a break at this time. But I'd like to know, for people who've had strokes, what they can do afterwards if, as far as rehabilitation.
7.
Dum 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 dee doo be dum 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 dee doo be dum 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 dee doo be dum wow 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 dum 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 dee doo be dum 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 dee doo be dum 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 dee doo
I
be
just
dum.
love that music. Buenos and Day. Welcome back to the second half hour of the Mondays with Monty show for this Monday, October 20th. And remaining in studio with me is a prestigious doctor from the Guam Regional Medical City, GRMC, and that Dr. Justin Hale. Buenos, and thanks for being here, Justin.
Suzu Smasi.
Hey, you got it. Buen provecho. Hey, so before the break, we were talking about strokes. And, I see sometimes maybe you won't be able to reverse these things, and sometimes it's more than 4.5 hours or whatever.
Right.
And maybe they're just going to live with the fact that they got a blood clot in their brain, but now part of their body, one side, it's usually limited with its mobility. And anything they can do.
Well, so I hope I didn't give any false impressions about, when you should come to the hospital. Obviously, if it's been 10 hours, you should still call 911 and come ASAP. I mean,
well, yeah, it's been 4 hours 31 minutes. Should I stay home?
Right. No. So get yourself to the hospital, and there are things we can do like supporting the blood pressure, for example, that can kind of help maybe with perfusing, getting enough blood to those areas. So, after that, after kind of the short-term event, the focus kind of changes to rehabilitation and to preventing another stroke. So, we're going to be looking at your blood pressure, your blood sugars. Do you have sleep apnea? And, how can we help you quit smoking, for example? All these different things that we'll be looking at. And then, as far as the rehabilitation goes, the brain is amazingly plastic. It's amazingly adaptable, and it can work. It can find new ways of doing old tricks, and workarounds, exactly. So, unfortunately, there's a lot of strokes that where people don't get any better, but then and it's not no fault of their own. It's just the where the stroke was and what territory that it affects. But some strokes do get better in the coming weeks and months, even up to a year out. You can see improvements in stroke.
Would they go to physical therapy too? Try to get the mobility back and
that is
build up the legs and the arm. And
exactly. So it's physical therapy, occupational therapy, and speech therapy. And so it's really a kind of a multi-dimensional approach to stroke care that really helps. And it's usually the team leader there is a rehabilitation physician.
Yes.
If it's kind of a inpatient rehab. And so we have an entire rehab unit and a nice big rehab gym at
GRMC.
At GRMC, right?
Wow.
It's right next to the neurology suite. So I think they're still looking for a rehab doctor. I've reached out to some of my colleagues back home, but they're all got jobs and kids. And,
you got to take pictures of it. Like today, it's just gorgeous out the window here.
Oh yeah.
The 8th floor, the Bank of Guam, looking out over the ocean.
Right. I've been trying to recruit, but I got a few people who are interested, but maybe we're seeing how things go.
Yeah, I can see that's a real specialist because like you say, you're trying to take care of those three aspects: physical, occupational, and speech.
Right.
And so you got all these things working together, and how much time do you do each one? Because I went to physical therapy. I had something in my arm before, and so I wanted to fix this. I went home and I kept doing the same exercises. I wasn't getting any better. Then the doctor said, "No, you're overdoing it. You're supposed to do it here, and then you're supposed to let it relax and heal and whatever. And then you come back, you do it again. You don't just keep doing it. You know? Oh, silly me. You know, you can. I get too much of a good thing.
Sure. Yeah.
So, you also specialize in sleep disorders and sleeping, and I found it interesting that I was talking to a doctor about sleep. To somebody, several people I know have gone and taken the sleep study.
Right.
And the doctor was saying 100% of the people that have gone for the sleep study have come back with quote-unquote sleep apnea, or diagnosed with that,
Sure.
And that they recommend that breathing device to sleep with. And that this doctor was telling me his patients have done remarkably better with that sleeping arrangement like that. I also found it interesting when he said he went to medical school. They didn't teach anything about sleep back, whenever that was, and now it's a specialty component of healthcare.
Right.
And it's a big deal.
Oh, sure.
Can you talk about why it's a big deal and what can happen to a person that has sleep disorders or sleep apnea? What is sleep apnea?
Well, certainly. I mean, sleep is probably underrepresented in medical education. There's a lot to cover in medical education, but we got a lecture or two on sleep. I think maybe just one lecture, or maybe little parts of lectures. But yeah, sleep it's really a cornerstone of health. I mean, you have this, you need nutrition, you need exercise, and you need good sleep. I mean, those are kind of that's the tripod that your health is resting on. So, there are things that can interrupt good sleep. I mean, it's not just sleep apnea, but certainly sleep apnea is very, very common, and partly due to the obesity epidemic. And it's actually very reversible. It's quite. I wouldn't say it's easy to treat, but for approximately 50% of the people who are diagnosed with sleep apnea, they put the CPAP on and kind of adapt to that pressure breathing within a night or two, and it's great.
It just looks funny if you haven't slept with one.
Sure.
It's like you're putting on a gas mask,
It does, yeah.
And your spouse is laying next to you, and you don't kiss the person goodnight. You put that on you.
Right. Some spouses really love it because their spouse doesn't snore anymore. A few spouses don't like it just because you can hear some air kind of rushing, or
you got just a little bit of a motor going there,
or that the air is the exhaust air, the CO2 is actually kind of blowing on the spouse. I've heard some spouses complain about that, but they have different masks now that can actually diffuse the air, so it doesn't actually it's not like a jet of air that's blowing onto the spouse. So there's a lot of reasons why people won't tolerate CPAP. It's too dry, the mask doesn't fit right. The pressure doesn't feel right.
CPAP is a breathing device.
Right, continuous positive airway pressure. There's CPAP, there's BiPAP, there's different modalities, but it's all the same idea of pressure breathing through a mask at night to kind of stent open the airway.
Now, sleep apnea, I understand it's a condition where you actually stop breathing throughout the night, occasionally. And when they do the sleep study, they tell you that every 7 minutes you stop breathing for 15 seconds or something. They write a report.
Sure, and I write those reports, and I actually look at your sleep from the first time that you go to sleep all through the night. So I look at, there's about 1,000 pages of data that comes back, and it's looking at the way how deeply you're breathing and your heart rate and other such things. So the worst case scenario, somebody might be actually stopping breathing for 100 times per minute. 100 times per hour.
Yeah.
So that's it could be several times per minute that they're actually stopping breathing. And when I say stopping breathing, it might be 10 seconds. By definition, it's by 10 seconds or longer, but it could be up to 45 seconds or.
Could somebody actually die in their sleep?
So they don't actually die from sleep apnea necessarily directly. It's not. It doesn't cause sudden death by any means, but it can
deteriorate your health. Huh?
Exactly. It contributes to high blood pressure and it can contribute to sleepiness on the road. So people fall asleep.
Yes.
And then get into accidents, and I think that's actually a fairly significant public health concern.
Well, I've sent several people over the years. My company's been open 24 years, and they've fallen asleep all the time at work. At their desk and so I said, I want to fit for duty. And I think you got sleep apnea.
Sure.
And they come back, and doc puts them through a sleep study, sends them over to wherever you go, and they have it. And every one of them, just a generalization speaking, they were all, in my estimation, were obese. And when they did something with their weight and lost a lot of it, they didn't have sleep apnea anymore.
Right, and that's kind of the neat thing is that sleep apnea is reversible much of the time. It's not always, but much of the time it's reversible with weight loss. And we prescribe weight loss obviously for people who have obesity related sleep apnea, but we don't wait around for people to just lose weight. We want to treat it right away.
Die of old age waiting for people.
Right, we treat it with CPAP, and like I was saying, the other 50% of people don't tolerate it very well, and that's where a sleep specialist comes in to help you kind of get comfortable with the machine. For just about every complication, every kind of side effect of the CPAP therapy that you might have, there's usually a solution or some sort of way of working around it, and that's where I, as a sleep physician, works with the patient one-on-one to really help them adapt to it and get comfortable with it. We want them to be comfortable sleeping with it.
What would you say is generally speaking, the right amount of sleep people should get a night?
Yeah, that's a difficult one, and I think it's an individual answer. I think ideally it would be best if people could kind of wake without an alarm, kind of go to bed at the same time every night and wake up, after their prescribed duration of sleep.
When I got out of the military in 1990, I never used an alarm since, unless I got a flight or something. It's going to cost me a few thousand if I miss it. And so I do that. I just go to bed, and when I wake up, I wake up.
Yeah, so that's what your body has told you, how much sleep your body has told you that you need. I can't tell you how much sleep you need. Now, we can look at populations and say, okay, people who are sleeping, maybe less than 6 hours, that appears to be, if you just look at all the data, appears to be a risk for, bad health outcomes like atrial fibrillation or heart attacks and such.
Wow.
The opposite is true too. If people are sleeping more than 9 hours, that's also appears to be a risk. Now, why is that? We think that probably it's people who are already kind of sick tend to sleep a lot. Just because they're not very...
they don't feel well.
They don't feel well, yeah. And so there's probably... it doesn't necessarily mean that it's the sleeping 9 hours that's causing them to be sick.
Too little sleep can cause health issues, and too much sleep could be indications you have health issues.
That's kind of the way that I would consider it, yes.
That's interesting. You in your life, you have done mission work, Guatemala, Mexico. I don't know what the Belize.
Belize, yeah.
Okay, that's a new one to me. Venezuela and the United States. What was this? A religious mission work, or was this a bunch of doctors said let's go do good things for these wonderful people in isolated areas? Or what were you doing?
I guess the
adventuresome.
Right. Well, it certainly had a lot of adventures. I guess the first one was when my uncle, who was a family physician, brought me out to Venezuela, and just
1 second, because I don't know how long George has been on the line, so let's take the call, and then we'll talk.
Sure.
Buenos and happy day, George.
Yeah, very interesting. I'm sitting in the parking lot and listening about the sleep apnea thing, and he seems to be very thorough. Appreciate your show.
Well, thank you.
There is a device they advertise on television so you can open the throat when you sleep. It's like a plastic, almost like when you're boxing, you put a in there. I want to get the doctor's opinion on that. Is that adequate, or you need that forced air breathing?
So, I'm not sure what the device is that you're referring to specifically, but it sounds like if it's something that looks like a boxer's mouth guard, then it's probably something they call an oral or a mandibular advancing device, and what that does is it kind of sits on both the upper teeth and the lower teeth. It kind of pulls the lower jaw forward and creates a little bit more space in the back of the throat to open up that airway. And that is a good therapy for people with mild or moderate sleep apnea.
Oh, okay. I was wondering because it's advertised, and it's, we get a lot of advertisement. Everybody's selling everything nowadays, so wanted to get your opinion. So.
Yeah, I'm not familiar with anybody who's doing it on Guam. I'd be interested in, if somebody is making these things on Guam.
Well, if it is, I'll make contact with you anyway over there. You seem like a nice, good doctor. So.
Well, thank you, George.
Very knowledgeable, anyway.
Yeah, he's knowledgeable, and you have a good talk show host. Very good.
Well, thank you so much. I appreciate that. Have a great day, George.
Okay, thanks for taking the call. Bye.
No problem.
Bye.
Okay, George. Yeah, I wonder if it's one of those after midnight infomercials.
Well, you have to be careful about those. So if you get an oral device, it really needs to be done by a dentist, and more specifically, it needs to be done by a dentist who knows what he or she is doing, and there are complications. Any kind of therapy, and medical therapy, or anything prosthetic that you're putting on your body is going to have side effects, and the side effects with the oral devices could be some jaw popping or TMJ symptoms.
I could see where, where they say the medicine's worse than the cure, or whatever, or something, where you're trying to solve a problem and you just made another one.
Exactly. Yeah. But there are workarounds to those for all the symptoms too. So, that's definitely one thing that I consider when I'm treating patients is are they a good candidate for an oral device, especially if they're not tolerating CPAP. CPAP is still the most cost-effective, most effective therapy for sleep apnea.
Gotcha. I've also noticed it at the sleep clinic that they give you the report, you take it to your doctor, and then you have consultation. But the sleep clinic doesn't sell the devices because they feel it's a conflict of interest.
Right.
Right. So, well, of course he says I got sleep apnea because he wants to sell me that darn machine over there for $300.
Exactly. Yeah.
We were in the process of discussing your mission work, Guatemala and Mexico and so on, and and then George called, so I took the call. But let's go back to that.
Right. So yeah, I guess like I was saying, I was in Venezuela with my uncle. We spent a week there doing a clinic in
your uncle's
in
a doctor?
the Andes. He is, yeah, family physician. So he kind of inspired me to go into medicine. And then I guess I just got a lot of interest in doing medical missions at Loma Linda. It's a Seventh-day Adventist medical school.
Oh, okay.
And so they are really mission-minded, and they actually support the medical students during the summer to go on medical missions. And so I spent 6 weeks in Belize, which is a great little country down in southern part of Mexico, just Yucatan Peninsula there.
Okay.
And
you craft your Spanish flavor.
That was one of the reasons I wanted to go to Belize, is because I wanted to learn Spanish. I should have done I'm not sure if Wikipedia was around at that time. I should have done my research, because they speak a lot of this kind of Creole as kind of patois that's really kind of a takeoff on English, and mix of English and Spanish and such. So I didn't learn a whole lot of Spanish there. Plus everybody speaks English. So
yeah. Okay.
Guatemala, that was a really, really neat experience. went there with an ophthalmology group. I was during medical school. I was thinking about doing ophthalmology as a career, and so we were, fitting people with glasses, taking out cataracts. I mean, people who couldn't see for 20 years, and they get their cataract taken out, and suddenly they can see. I mean, it was just really neat.
Yeah, you can. My wife had a cataract that she couldn't see out of her eye. And Dr. Lombard Naval Hospital just took that sucker right out of there. And he commented. He said, "I'm good at this. I did mission work, so I've seen them.
Right.
So I know what you're talking about."
Yeah. Well, the ophthalmology is a really good way of doing medical missions. It's so kind of something you can go in and take care of quickly, and then and people can get results right away without too much technology.
Interesting. I saw some interesting facts in your bio. One was your dad was a certain place in 1977 and met your mother.
Right.
And could you share with the listening audience this little story?
Right. So yeah, my dad, David Hale, was here in the Navy, and he was on a subtender.
The Proteus, probably.
Right. Exactly. And then he was attending what was that called? It was a Bible study, servicemen's Bible study, something.
I believe you.
I got you. And my mother, Holly Hale, she was here on a contract, teaching school. She was a music teacher at Barrigado Junior High.
Okay.
And they started going to the skating rink and kind of hanging out, and they,
it was a skating rink in Dedido, if I remember right. Yeah.
Yeah, my mom lived in Dedido.
Okay.
So I live in Dedido now. And yeah, they ended up going back to the States, and my dad got transferred back to the States, and my mom was wanted just kind of followed him back to the States. And they got married, and then so that was kind of I always grew up hearing stories about Guam and about how they had met. My dad was a big scuba diver. He says they were on this kind of island hours. I guess they would get up at 5 in the morning and go. They'd start work I think at 6, and and then they would be off at 2 o'clock in the afternoon.
Scuba diving hours now.
Yeah, and then he was at 3 o'clock. He was in the water. So he ended up going to truck to scuba dive there.
And, gee whiz.
I mean, he's just
this is the place to dive.
Yeah,
And this whole region, truck being one, and Palau is one that they, people come from around the world that dive in the Rock Islands and stuff. And but I learned when I came here in the Navy in 1970, I took the classes and got my. We always bought our equipment on the Proteus at the ship store. Yeah, because it was the best price, and we just nobody wore wetsuits. We wore this Levi's kind of thing when we went. So, pretty. That's just the way it was. So it was just the best diving.
Yeah,
it still is.
Right.
But I just don't like carrying that heavy tank around. Now there's another good story, and we have some similarities here. But it's not my grandfather, but it's my father and his brothers. But tell me about your grandfather and something to do with liberation of Guam.
Right. So my grandfather was. He was kind of going through the Pacific Islands toward the end of the war. He had initially wanted to go into the war after his brother was shot in the European theater. He had really wanted to go fight in Europe, and but by the time he got into the service, he was 17, and let's see, was he 17 or 18?
Yeah,
and he I guess would have had to been 18. He went out to the Pacific, and he was a belly gunner, so he was kind of landed on several of the islands in Micronesia. He was I know he landed on Iwo Jima, he mostly ran out of Tinian. He would do these watches, and so he landed on.
Go over there while you're here. It's really historic over there. They've done a good job at putting monuments and nameplates and everything over there. Anyway, continue on.
Yeah, so he ran watch over Guam, and he would do 12-hour shifts.
What service was he in?
He was in the Naval Air Corps.
Oh, Naval Air Corps. That's interesting. So was he here around the time frame of liberation, or?
So he was here after it was liberated. He never saw any action, although he wanted to.
Chomping at the bits for action.
I mean, here's a young guy who's just really wants to.
Fresh out of high school and ready for bear.
Yeah, exactly. He had an 8th grade education, and he's always been he's a voracious reader, and he's an intelligent guy, and but he only had a partial 8th grade education, and he got into the Naval Air Corps, and I guess they told him he was in with a lot of college graduates, and they told him that they said, I don't know how you got in here because with your education level, but he kind of learned from a lot of the other guys, and he said he was in there with there was one guy who was particularly smart, and he just kind of attached himself to this guy, but other guy didn't have much practical experience, so they practical knowledge, or and so they kind of complemented each other, and so his achievements were I'm really impressed with my grandfather's achievements. And
wow, I can remember when I was going to graduate school. I went to Navy postgraduate school in Monterey, and a professor said, if you want to be smart, hang around with smart people. And I've never forgotten that. And but sometimes smart people aren't the most fun people too. But you do learn a lot faster. People who have done that and have creative thinking. We're coming up on the top of the hour, kind of. What have I missed that you'd like to let the listening audience know?
Well, I guess we're all my colleagues and I are really excited about the new hospital. We're excited to start seeing some patients, and so if any of I think the patients need right now the patients need a referral from their primary